จะมองเห็นแล้วอาจจะบอกว่าเรื่องการพูดข้อเด่นหมดแล้วโดยเฉพาะในสถานที่ข้อเด่นนั้นโดยสิ่งนั้นว่าเป็นยั่งระยอนยั่งมีการข้อเด่นนั้นโดยตรงและเราจะมาได้ส้นขนาดเกี่ยวกับการข้อแก้ในการค้นคว้าการวางแผนการเก็บกำข้อมูลการวิเคราะห์ใหญ่ต่างๆและจุดประสงค์หลักก็คงที่บางสิ่งที่บางเราจะมาดูกันที่สร้างจุดประสงค์หลักเนาะจุดประสงค์ที่หนึ่งที่เราจะมาบอกว่าเพื่อปรับปรุงเนาะความรู้ของเขาเกี่ยวกับวิธีในการมีการค้นคว้าโดยเฉพาะในสถานการณ์ส่วนนั้นตัวที่สองนี่พวกท่านจะได้มาโอกาสต่างๆทราบทิศในการสิซ้อนโดยเฉพาะเป็นบทบาทที่5ถึง7เนาะและการในมือที่สร้างนี่แหละเขาจะได้เลือกเอากลุ่มได้กลุ่มหนึ่งมาซ่อนแล้วก็จะฟีดแบ็กว่าจะซ่อนหมานี่เป็นอย่างนี้ที่เขาที่เราโครงการเป็นเหมือนกันนะจ๊ะสร้างที่ไหนกับซ่อนของประธานนั้นแล้วอาจารย์เนี่ยเนาะที่จะมาที่สุดท้ายที่จะมาจ้าคนเนาะเราจะได้มาคุยกันเกี่ยวกับเรื่องการที่เขาทางสถิตินั้นคือให้นานนี่โดยรวมมันก็ที่เขาการอยู่ของท่านเขา I understand you may have any question.
So, this workshop is supposed to be highly interactive. So, we welcome questions as we go through the lectures, and we also encourage you to share questions openly. If you have experiences with some of the things we're discussing, feel free to discuss your own experiences as well. So it's not just limited to our own experience, so we can all learn from each other here. Laptop on SCADA will be the software that we'll be using, and I believe we have a section that we're going over SCADA with. So we'll have some time in addition to talking about the different concepts in nutrition and design. You will also have some time to practice using the software SCADA with the data analysis. So the workshop from today for this week as well as next week, the structure is as follows. We will start at 9 a.m. and end around 3 p.m. every day. So we have a question for after school to any of us to have time between 3 and 3:30 every day to ask those questions for all of those office hours. So basically there are opportunities to ask those questions. And one section will be held here will be speaking English. Dr. Ahmed will be helping us with translations. And we will be recording the video. So the will be recorded, our teaching will be recorded for future training purposes. And we will all have breaks. Well, basically everything will be here. And just to mention, we want to mention and acknowledge the authors and organizers of this session. So we organized by the USAID and support for this. Thank you for us sitting here in years through the United States Agency of International Development. And so this is a brief outline of the schedule of what we have planned. So today we'll start out with introductions, and right now we're discussing our goals for the next 2 weeks. And then we'll move on to talk about basic concepts of nutrition. During the morning session, we'll talk about concepts of nutrition, and then we'll talk about some statistical sampling. So you'll be getting a copy of this, and we'll have the details. So we have the details of what we plan to discuss during the next 2 weeks outlined here. But so this week, in the mornings in general, this week our morning sessions will be focused on a lecture format where we talk about a specific concept to lecture in a lecture format. And we'll have a break. And then in the afternoon, or right before lunch, we'll have discussions and we'll have teaching demos or teaching demos or different programs that we have planned for you from 11 a.m. to noon. And then we'll have lunch, and then we'll move on to the actual sessions and office hours. And the format for the second week is very similar. We'll have discussions in the morning, lectures in the morning. We'll have a break after the discussions or lectures, and then some activities. So some of these activities are designed, as I mentioned earlier, for you to demonstrate how you would teach some of these concepts to your students. So you also get to demonstrate and teach. So it's not just us right on the teaching. So just to be aware of that. And then same format for next week. We'll end up week, and we'll end up week with office hours from 3 p.m. to 3:30. Okay. Any questions?
เราโดยรวมแล้วนั่นคือว่าพวกเขานี่เป็นการเวิร์กช็อปนั้นก็นี่เป็นการซื้อท่านของต้องการเลยดังนั้นเวลาท่านมีถึงท่านแค่ท่านใดโลดแล้วก็เราเราซื้อในประสบการณ์ต้องเข้าใจกันเนาะสมมติว่าเรามีประสบการณ์ในการที่ทำพวกก็จะมาประสานมาเช็คของคนต้องตรงเดียวนั่นต่างๆเนาะแล้วการนั้นเราก็คงพวกเขาที่มันจะเริ่มไปเข้าโหมดแล้วหลังจากจะสิ้นสุดโมงเช้าโมงแล้วนอกจากนั้นท่านมีคำสั่งเรียกส่วนตัวสร้างมาทำก็จะได้มองมันดีสร้างหมู่และสร้างหมู่อื่นเนาะแล้วเราจะมีการกินข้าวเที่ยงกันนี่ดังนั้นตอนช่วยเขาจะเห็นว่าเรื่องหมู่เนาะเพราะเขาจะหลังของตัวต่างๆอยู่นี่แล้วเขาไปรู้สว่าสุดท้ายหมู่คำนี้นี่เป็นองค์การ CIS เนาะที่ว่าเป็นผู้จัดการปฏิบัติการเทศโครงการตัวนี้เงินสนับสนุนที่ว่าให้พวกเป็นหมันนี่เราเป็นที่เรียนและการควบคุมและส่วนระยะสิบนี้จะมีการอัดวิดีโอเนาะซึ่งว่าวิดีโอที่อัดก็คือโมเมนต์ที่เอาไปเห็นอันอื่นต่อเนาะก็คือว่าเรียนใช้เรื่องการเขียนการสอนนี่คือเนาะคือว่าคือสิบมีปัญหาเนาะการอนุญาตให้ได้อัดเนาะแล้วมาตอนนี้ทางหนึ่งถึงท่านที่เราสายเป็น silent listening no question คืออยากเช็คเป็นแสดงเองเนาะก็เราจะตายคือเป็นมันนะคิดแบบว่าเข้าใจมีคำถามเองเขาเข้าใจกันได้ไหมครับได้มีคำถามไหมโอเคครับเพราะว่านี่อยากมีคำถามใช่ไหมได้เรื่องใดที่เราแบบก็หงน่าเรื่องสร้างหงนะเป็นเรื่องหงมีแล้วที่สบาย
Alright, when we have more questions, we'll move on to the first issue that will be covering with you, like this nutrition research. So remember that one of the goals is objectives for strengthen our public health research abilities in nutrition research. So public health nutrition research. So this first module was developed by Paula, who was a graduate student, and she has since graduated. She got her PhD and is now doing a postdoc. So I just want to acknowledge her. And so, overview of what we'll be talking about. So, in this module, we're going to go over the basic concepts of nutritional epidemiology. So, if I were to ask you right now, what is nutritional epidemiology? So I'm asking you a question. What is nutritional epidemiology? What would you say?
Nutrition epidemiology นี่นะเป็นยังก็เปล่าก็ได้แต่รูปแบบที่กับตัวปรุงกับบัวแบบนี้ว่ามีเกณฑ์จะมองมาทำงาน
I'm not sure it's the problem, but
เรารายตัวเนี่ย
the first and foremost nutrition involves or integrated for all like that. Before before after.
So we did have an idea already of what nutritional epidemiology is. You gave us your idea. You talked about behavior. You talked about individuals. And so that's so we'll see what your definition of nutritional epidemiology would be after going through this. So and it's sharing and things that you will to.
สำหรับในกลุ่มเราเรื่องระบาดเป็นตัวอย่างเกี่ยวกับเรื่องโภชนาการมันแมนเราเรื่องที่แบบเรื่องต่างๆเนาะเอาคนอื่นดิแต่ว่าเป็นระบาดเป็นตัวอย่างเนาะต้องโภชนาการ
So we'll talk about basic concepts in nutritional epidemiology and see if the definition of what nutritional epidemiology changes and the end of these next 2 weeks. And we'll also talk about what do we need to consider when we're looking at nutritional data. What do we need to consider when we have nutritional data in front of us or want to do some analysis? And then some directions in nutrition research and identifying research aims and developing hypotheses, research methods in nutrition research, how to do literature reviews, and also how to develop research and manuscripts on peer review. So it sounds like a lot. I believe it would be a very useful module. So first, let's start with some basic concepts. So nutrition research. So when we're collecting data on nutrition, why do we do it? So this is a question to you. Why do we want to study nutrition?
เราใจเป็นยังไงที่มาเหตุการณ์เขาจะเหตุนั้นเป็นยังจริงจริง
Training was that we didn't aware before. Most of the cases were women. When we look at the food, and people US or Thailand and other countries, chicken, if I chicken is food, but a lot of things the opposite, you cannot say to McDonald's, $1 well, that's why the opposite trend we try to deal with. The addition the have the true one food and have food nutrition like a food house, right? Event nutrition and food for so that is true one is we have to identify
what we're interested in once to start nutrition because we want to observe certain patterns is somebody, not just malnutrition or stunting, but then also the other end, the overweight or obesity. Within one sex more than the other. So we want to look to see how nutrition can potentially contribute to that. And then I'm also hearing that we're interested in learning what is good food, what is bad food, and what we think is quote unquote good food. How does that contribute to good health, or does it contribute to good health? And does quote unquote bad food contribute to bad health? Those are the questions how do you take this concepts so nutrition in general is very complex. So sometimes you can have a person who eats very well, but then they're like the index even though they're eating very well, and then the other way around. So nutrition is a complex concept that is linked to our behavior, the environment we're in, our social and different biological factors. So biological factors we're not aware of this, but biological responses to what we're eating. And these factors determine our food intake, dietary intake, nutritional status, quality of life, and the health status in general of our individuals. So I would say these factors are linked. I would say these factors are linked to our food intake, the different factors, the social, behavioral, biological, they're linked. And they're also linked to our nutritional status and quality of life. So, if we want to talk about one of the things we want to talk about is, and this was brought up earlier about this diet. So there's a first picture here.
ตอนนี้เขาฟังได้เงียบก่อนนะเนาะส่งให้มีทางเราทางนี้โปรเปกได้เนาะทำไมไม่ได้นั่นกันเปิ้ลมันสไลด์ของหน้าที่เราไม่อยากแชร์
And so age, gender, activity level, and health status are all linked to individual nutritional needs, and in many cases, they're also related to our habits and preferences. So the diet has an impact or influences not only our long-term health, but also our health conditions in general. And that also, these are also influenced by our age, our gender, and how active or inactive we are, and also health status. So you'll notice that there are some individuals who might be more active. And when they're more active, they might have higher nutritional needs or needs more compared to individuals who might not be like the deficit or excess of essential nutrients during different stages of life and are related to the appearance of short-term and long-term effects in health. So one of the few it was in May. We were in Singapore, and when we were in Singapore, we met with some of the researchers there, Chief. So anyway, so we're talking about this. So this second point is talking about deficiency in nutrients, and one of the things that we talked about when we were in Singapore was the deficiency in beta carotene in this area, in Southeast Asia region. And so there's the concept of promoting the eating of golden rice to try to, and so golden rice, for example, is where the rice has been fortified with beta carotene, and encourage individuals to eat this rice in order to deal with the deficit that's associated with the deficiency in beta carotene. So So to deal with the division, so that's an example of the division and how what's the new potential division and to address the division. So the role diet, what we're eating at different stages in our lives influences our health. So prior, so at the beginning, when at the preconception stage, what we eat will affect fertility, genetic changes, and also late life genetic expression. So what that is saying is that there are studies that show that what happens pre-conception stage actually also influences not only genetic changes, but even how certain genes are expressed later on in life. And then what we're eating also affects the fetal growth and development. So this means maternal determinants, metabolic and nutritional changes in the mom, the mother, and other deficiency will also affect the development of this. And we also know that what we eat affects placental function and also nutritional needs throughout gestation. So what this chart is showing is that there are different nutritional needs at different stages of our lives. And so pre-conception, there are certain nutritional needs, fetal development stage, and growth, there are different nutritional needs. In the infancy stage also, we have certain nutritional needs, and also childhood, because we're going into childhood and going through adolescence, we have nutritional needs that affect height, weight, and also potentially will also determine where onset of chronic diseases and influence the aspects later in life. And also adulthood and aging. So we know that one, for example, they say when you eat less during adulthood and age, you might eat less before you expect. And so what that's saying is that the idea of what we eat changes and what we need nutritionally changes during different stages of the life. So before we move on, any questions?
มีผ้าในเหียนก่อนแล้วเหมือนได้เหียนไปแล้วมีคนข้างตั้งไว้มีก่อนมาหอดนี่test the channel because we save the video for them to learn by themselves first, and they do the test. By now they don't have any question yet. No? สรุปแบบนั้นเงียบแต่ว่าไม่เป็น
So we're continuing to talk about diet and long-term health. So poor diet, as Michael was saying, poor diet is something we have an effect on our health. So harmful effects for nutrition include poor development and growth, high prevalence of chronic health conditions like obesity and cardiovascular diabetes, and also higher risk of illness here. So, for example, if an individual prior to getting experiencing an illness has a nutritional profile at the beginning or the onset of the health condition, their severity can be influenced by that. And also the fact that slow recovery. So if you're healthier when you're experiencing a health condition, the recovery is much better. And also poor nutritional status can also affect our immune system. And poor nutrition can also influence the risk of disability and also the premature death. The risk of early mortality. Also, it affects cognitive function and also economic and social effects.
So, therefore, we must support treatments and interventions for political decision-making with scientific evidence. So, what this is all saying is that poor nutrition is not good for our health. And it has many different consequences, from the cognitive consequences, chronic health conditions, and even if you're not feeling well, then it affects the ability to work. So it can also affect our ability to socialize, social effects, and even our ability to go to work, so which will in turn affect our economic status. So, knowing all these things, in order to be able to come to a point where we're now at the point where we can discuss some potential policy changes or anything related to what can we do to improve the diet, we need scientific evidence to be able to make these decisions. So it's important that decisions that are made, we make them based on good scientific practices, so that the consequences that we're hoping will be affected by the implementation of treatments and interventions or policies are what we hope to see. So we don't want to just say, well, we think eating something is bad, without having the evidence of that is the truth. Might be bad for some people and actually not bad for some people. So we need to know how things work before we start making decisions on it. So why is nutrition research important? So one thing that I joke around, as I mentioned earlier, I'm a statistician and I do work in nutrition research. And I joke around that I'll always have a job. And that is because we'll always need to eat, right? Everywhere you go, people need to eat. So there might be some things, even if we're doing some complex modeling, that might be harder. Activities, eating, everyone eats. So no matter where you go, that's one thing we all have in common around the world. We all need to eat.
I get lots of jobs. I don't work in nutrition. I'll get unemployed.
No, keep doing nutrition and you'll remain employed for a long time.
That's what check it out.
Well, if you go in right now, you might just.
I'll go farming and make food for that. In general, when we talk about the focus, in general, we allow nearly 1,000 years. And then why they don't focus on this design?
They don't focus children 3 to 5. Under 5 years old? Yeah. In Lao or in general?
In general.
Oh, I don't know. Does anyone know? Why do we focus more on house things? Yeah, now.
Not just people under 5, but
Even more even after 5. Maybe it's that gap.
and I think that it's more attention for the school age and adolescents. Right, focus on who has an very long period, but I think the shift is coming, and if it's happening, that's perfect.
Thanks for that. Thanks for bringing that up, and thanks for asking the question. So we were part of the group that did the calculations for dietary representatives at the Budget request last year. And before, we usually just kind of put everyone together, in terms of the dietary needs or different individuals. And so, what we emphasized last year was we actually did this calculation slightly. And so we just focused on the areas of our house and we looked at different things, and all the way to different stages of the process. So I believe that's true. So why is nutrition research important? First, it allows us to develop science-based evidence on how nutrition influences human health and disease. So, and also, we're talking about human nutrition here, but nutrition in general is not just in humans, right? There's animal nutrition and so on. And also nutrition research allows us to identify and address different gaps in nutrition knowledge and how they relate with health and disease. So first, we get science-based evidence on how nutrition influences our health. Then we also try to identify what are the gaps. Are there gaps that we need to be aware of in nutrition knowledge and how those gaps might influence our health? And then also try to build a bridge between researchers and practitioners to provide the best practices for treatments in the population. And also it allows us to make sure that we are using results that are most valid, that have come to for peer review, and we'll be talking more about peer reviews today. And also, nutritional research is important because they allow us to provide critical and compelling evidence for decision making and policies, the ultimate goal of improving population health and community society. But this sounds like, well, it's a quite a process, right? It's not something that just because we observe one time, then we want to ultimately make a policy change. It's something that takes a long time before we actually try to implement these policies. So there's a health impact pyramid, and I'm not sure. So what do we do with nutrition research, and how it's looking at it from an economic and social perspective? So we talked a bit about nutrition and how nutrition is important for our health and for prevention of health conditions, but also why is nutrition important for someone who's studying economics or someone who has social impacts or how individuals behave in a society. So nutrition knowledge or knowledge of the best practices in nutrition allows us to reduce the cost in treatment and hospitalization due to chronic illnesses. So sometimes the best approach, or if not sometimes, actually, I would say the best approach is prevention, right? Because prevention, sometimes people think that it might be more costly, but in the end, when it becomes it's gone too far to address certain health conditions using preventive approaches, it becomes too costly. And that cost is not just talking about the financial cost, the emotional costs, human costs as well. So it also allows us to reduce morbidity and mortality. And so just to ask the question to see if you're still listening to me. So what is the difference between morbidity and mortality?
การที่จะมาเป็นต่างกันเนี่ยต่างเข้าใจแล้วนะเราพัฒนาใจเราลดการที่แต่สิออนเดอร์เซอร์เราเนี่ยออนเซอร์ต่างๆเนี่ยการเก็บเกี่ยวเนี่ย
Something that teacher.
Yes. Is there a difference between morbidity and mortality?
บุญที่ซื้อมันก็ตามเนาะเดี๋ยวเราตามฟ้องศาลเป็นทุกสิบปี
Like doctor,
What?
is it illness, take time or treatment, good, spend more money. But quality is that it's one time. Then
And also increase work productivity and reduce work days, or I'm sorry, reduce sick days. So if people are doing well and they're feeling well, then it would affect their productivity, right? They'll be able to come to work and also reduce the number of days they have to take off for sick days. And also, it would improve food security by enhancing education and food access and availability. So one thing we talked a bit about during COVID was food insecurity. Food insecurity was something that a lot of different people would talk about, and we can still talk about during COVID. And so if we improve food security by enhancing education and access to availability, then that also influences in a positive way the economic and social impact of good nutrition. And also transform the traditional agricultural and farming sector into sustainable economies. So this is a big one. So we want, farming is important, and having a good nutrition research allows this collaboration and also knowledge of how to improve agricultural practices, and also have a relationship with farming sectors that allows them to develop approaches that would be sustainable for farmers. Sustainable farming. And so regional nutrition research priorities. So there are different priorities for nutrition research. And so, for example, one is chronic malnutrition, micronutrient deficiencies throughout the lifespan, chronic diseases, maternal and child health in general, food security/insecurity, sanitary environments, which is very important, and sustainable agriculture. And so these are different topics that different topics related to nutrition research priorities for different places. So for some places, the focus might be focused on malnutrition, chronic malnutrition. How do we address that? So malnutrition is not just about not eating enough, but it could also be overnutrition, or eating too much of something, which is not necessarily of good benefit to the health. So I was talking about the deficiency of beta carotene in Southeast Asia, and the promotion of golden rice to try to address that. Have you all heard of the golden rice? So this is the question: have you heard of golden rice? No? Yes?
we have also now the vitamin like
So what color is it?
vitamin 45 white.
Okay, so there's one that
there, another one, so this one it's fortified with beta carotene to help deal with the deficiency, vitamin A deficiency. And so trying to promote eating, for people to eat that. So it's called golden rice. I actually had, I had some of it in my bag, but I don't think I brought it with me. Might be my suitcase. It's, well, I guess you could, it's yellowish, but it's interesting to see. So this was something that we talked a lot about in Singapore, when we were there talking about nutrition and different ideas for research. So I got some. This is something that school promoted already for with vitamin A deficiency. So I was wondering if you've already heard about it.
You have to buy it, but it's quite for maybe the different colors. They got this.
That's the problem now. So the research question also was, how can you fortify rice to address deficiency in beta carotene for people to eat? Beta carotene carrots, for instance, orange. But those are real beta carotene, the color will change. And so people might not necessarily want to eat it. And so that's the challenge. How can you promote something as healthy when it looks different from what people are used to? So that's an example of how societies try to deal with deficiency, for example.
I have a question. Because, we have I really found that the fat consumption down. Maybe the Eastern people is one of the because of vitamin D, the oil, so its consumption is low. Maybe because of the consumption of the what do you think?
Well, that's a possibility. I mean, that's a possibility. I know, for example, with I mean, that's a possibility. I don't know what to say. I can see the possibility. What would be the potential reasons for why people are having the deficiency? That could be a potential one. But I don't know, what else, I don't know what else contributes. Is it that people are really not eating enough of nutrient foods that could, or is it because of an absorption issue, because of certain processes need to take place to absorb the nutrients in the body? So I think that's an interesting research question.
One is loaded center, and how what is the direction in the future? Not focus on golden rice only, but what type of activities effective in all.
Yeah, I think that's a good point. So how can we, knowing that certain nutrients are deficient, and wanting to promote the consumption or at least the consumption or access to these nutrients, should the changes be made in with what people are eating, or vitamins, or what kind of, so those are, I think that's an important question. So for example, the golden rice is one, it's dealing with one nutrient, but then would you want to eat something, I mean, this is just a general question, that has, sometimes also when something has too many nutrients or it's been fortified in too many ways, encouraging its consumption sometimes can be a bit challenging. So I know that people are studying, and this is an area of interest to many people. How can we, at the national level, how can we promote the consumption of different kinds of foods that would address these nutrients? But the key thing is, it's just a resistance. There is a resistance for people who might need it to eat something that they think, even though it might be good for them, there's a resistance that something has been fortified, it has been changed, genetically modified or something. And so there's a reality of, will people eat this? And then there's also what we think as scientists will help to address these deficiencies. Or how do we bridge that gap? I think that's always a challenge there. That's a challenge. But I agree with you that it might not be a good idea to only focus on one nutrient at a time, one deficiency in one micronutrient at a time. But then there's how do we promote something that does deal with the multiple deficiencies of micronutrients that people will be ready to eat. So, for example, I use the example of the golden rice because it's very specific to this region, Southeast Asia, and the resistance that people are having towards it. And people say, hey, like golden rice is not promoting. People still don't want. There's still a bit of resistance to eat. So some major influences of nutrition research. So there are different, one is economic limitations. So not that long ago, we were in the Philippines, and so talking about research in the Philippines with researchers at the University of Philippines, Manila, and also the Indian Nutrition Research Institute. And one question came up about trying to design studies there where they are also interested in looking at different micronutrients, physical activity, and other factors, and how that all influences the health. And the idea was they wanted to define studies and ask, well, can they do that? The way, for example, the NHANES does it. And so NHANES is a publicly available database in the US. And so the question came up when we would like to do this, but economic limitations, it's expensive. How can we do this? So economics does definitely influence what kind of data we can collect. But one thing we do need to keep in mind is that even with limited funding or economics, we have to start with where we are. And I believe that's what I said when we were there. Start with where we are. So a design does not have to follow what other people might be doing in a more affluent nation, and we can still do research. That's very good research with the resources we have and still be effective. So the first point is that some of the things that influence nutrition research, food economics. There could be national and international funding that's limited. There could also be institutional structure to administer funds that might be a bit slow or it just doesn't quite work as efficiently as needed. And then also limited access to information. So limited access to existing information and evidence can also influence nutrition research. And this is what we were talking about earlier about why only focus on, as an example, why only focus on one micronutrient when we could actually look at multiple micronutrients and encourage people to consume that. So that's an example between gaps between academia or and researchers and policy developers and then to people who will consume. We can develop food that we think address a lot of, for example, deficiencies in micronutrients that will benefit our population. And then you will get into a point maybe where after doing some rigorous scientific studies, come up with policies, but trying to also encourage behavior and that, changing people's behavior is challenging, right? It's not easy to change behavior. And so we also need to think of all these. So we can develop something that's very effective, but and we have to prove that it works. Next step, we work to convince policymakers to come up with promotions to promote the consumption of this. Then we need to find the actual consumption of the gaps between all of that. And then lack of collaborative efforts between different agencies. So you can have at one point, I think at one point in the US, this might have gotten better, but actually it has. But there was at one point data collected in this agency and then another data set by another agency on the same people, but they were not necessarily between them. And so that can actually affect research. And so I remember years and years ago, I was working on this project. And it was such a frustrating project that I decided to go back to school. And that's a true story. I was working with the Medicare data, which is Medicare data, which at the time I think it's gotten a lot better, but it was very, very trying to link people who were hospitalized and why they were hospitalized to their Medicare data. It was such a very difficult task that I decided I just did not want to do that kind of work. I wanted to do research instead of actually doing that myself as a data analyst. So that can be a very painful process when we don't have collaborations between agencies, where we don't data, for example, that we have are not linked. It can also influence our research. So, how can we improve nutrition research? We can do research practices, peer review, balanced workload, time designated for research would allow better research, publications and incentives to conduct and also publish research findings, continuous education to learn new methods in research, and also looking to make sure that when we're doing nutrition research, we account for cultural factors, ethnicities, and beliefs, and also incentives for collaborations between different organizations. And so overview of nutritional epidemiology. So nutritional epidemiology, I was asking earlier, what is nutritional epidemiology? Nutritional epidemiology allows us to study how diet influences the health of the population throughout the life course. So we talked about how diet influences from section to the development, childhood, and so on. So the nutrition allows us to look at how diet influences our population's health throughout their life course. It also aims to address dietary intake and habits and their associations with the list of diseases, and considering the complexity of human diets. And
okay, that's a lot. So let me just put it there. Let me just say this. So nutritional epidemiology, in addition to allowing us to see how people in the population, what are people eating and how that's affected their health at different stages in their lives, there are different factors, right? We're humans. And so we have genetic predisposition that could influence how we respond to eating certain things. There are social factors. So social or structural factors. There are individuals who might have access to really good food, quote unquote, compared to others. So that would affect what they're eating. Physical activity. There are some people who have the ability to perform more leisure physical activity compared to others. That's also not only a social factor, but also a physical activity factor. And also, nutritional epidemiology can be supported by multiple disciplines. So we're talking about nutrition epidemiology, but there's so many areas that one can focus on. We can have people who work more with biochemistry, cell culture, animal studies, biostatistics. There's so many. Nutritional epidemiology is very, very broad. So I'm a biostatistician and still working in the area of nutritional epidemiology. During my postdoc, I worked in a lab that was doing a lot of biochemistry and cell culture work and still looking at nutrition. And it also varies, the methods that we use varies based on the research question of interest. Okay, so why do we conduct dietary assessments? One of the reasons why we do it is we wanted to know what people usually eat affects how their health. And also we want to know about the adequacy of the nutrients that they're consuming. And also look at how the interactions and associations between the nutrients, foods, and diet with different health conditions. But diets vary between and within populations. So sometimes speaking overall about certain nutrients and how it influences health outcomes for everybody, it can be challenging because we all can eat, even within the same country, we all can eat different things. And so we want to be able to have tools that are valid and reliable and sensitive enough that don't necessarily warn or encourage people to change what they're eating in response to this tool. And so far, that's still a work in progress. So let's see, what time is it? I wondered.
Now 10:30. We break 10:45. Now 10:30.
10:50?
10:30.
Oh, it's 10:30. We're taking a break at 11.
10:45, right?
It's supposed to take. Okay. All right. Okay, so I still. Well, we started late. So what time am I supposed to stop?
I think you're hoping to do both of your sessions before the break.
Okay, so why don't I stop here? Let me stop here because I think, yeah, let me stop here. I think this. I know we talked about this before. Let me just quickly. So, how many of you were here last year when we talked about nutritional assessment?
มีภาคใดที่ว่าบ่ได้เข้ามาตอนเราอันเฮ็ดเลคเจอร์เกี่ยวกับตัวนี้นะ no he is not here yeah
so this is going to be a review of what we talked about last year. We got more questions related to this. So the last thing that I said was that when we want to know, we want to do nutritional assessments, we want to be able to use tools that really capture what people are eating. And not only what people are eating, that also is not too expensive. And also we don't want to
ask questions in a way where people will change how they're eating and what they're eating when they are using the tool. Right now,
that's very challenging. It's a work in progress to do that. So nutritional assessment has gone far, from food nutrition, from the questionnaires. Last week, or was it 2 weeks ago, we took part in a short course on obesity, and one of the teaching as part of the short course, and someone came. Just got funding, and this is something more and more individuals are doing, where we're using more complex tools such as imaging. And analyzing the imaging data to try to do a better job of assessing how people are eating. But as you can imagine, that's very pictures, but not only just taking the pictures, but now for us that when we're analyzing the data, we analyze the data as images, for example. And so it's things are moving. Things are moving, but at the same time, something like that is still very expensive compared to doing a 24-hour question recall. So 24 hours. So nutritional assessments, two main methods that are often used. One is the 24-hour recall, and so for the 24-hour recall, the strength of the 24-hour recall is it allows people to recall what they ate 24 hours ago. So some of the strengths, because we're not having to recall something from a much longer time period, is that the literacy of the respondent is, so you don't need to be so you don't need to be, it doesn't require the person to have, I don't want to say, it doesn't require a lot of high level education to be able to know what you ate the day before. And it's less likely to change dietary behavior because we're simply asking you what did you eat the day before. And also minimal respondent burden. It's not something they have to carry around for months and months to keep asking keep responding to. It's just something that relates to what people ate the day before. But it requires people who is trained well enough to be able to ask the question. And also, question size estimation can be a problem. That's where the images can be helpful. And foods may be left out or not included for different reasons, and that's where recall error can sometimes come into play. And relies on memory for items and portions. So relies on what people remember they ate the day before and how much. So if we ask one person, how much did you eat yesterday, and they say 1 cup. So you know that this can be 1 cup somewhere, and that can also be 1 cup, right? So sometimes we might both be saying we ate, it was 1 cup, but was it really 1 cup? 1 teaspoon. Teaspoon is also, even if I look in my own kitchen, there are different sizes of the same of what's called a teaspoon. So when you're baking, it calls for 1 teaspoon, but if you use the wrong teaspoon, then it would not necessarily come up. So these things really, it might not necessarily be because someone is trying not to be honest. It's just that how things are being measured might not be consistent. Another one is the food records, and this one is it's prospective. Memory is not required, and weight portion sizes can be more accurate. But the problem with this is that it's a long form, and coding can be labor intensive, and also may cause behavior change because people know what kinds of questions or what kind of things how to respond. And it requires someone to be able to actually fill out the form, forms correctly. And it's a pain. It can be a pain. I took a course on nutritional epidemiology in the summer course at Hopkins once, and as part of my homework, I was supposed to do this, and I will be honest, I did not finish that homework. It was too much of a pain for me, and I'm a researcher. So it can be a high respondent burden is an issue, and lower response rates and being able to generalize. So the FFQ, the food frequency method, allows us, if we're interested in looking at what people usually eat and how that affects their health. So this is the FFQ is a good one. It's self-administered, or it can also be an interviewer who's asking the questions. It does not promote a person to change their behavior because it's usually, the questions are related to what people are usually eating or what people usually consume. And it reduces time spent on coding and data entry, can be used in large population studies, and useful for ranking what the levels of what people say they're eating. But the problem though is that the food frequency quick questionnaire can also be a long and tedious questionnaire. The food lists and the food lists rather than meals and not total diet. So it's not it's asking food items that are eaten, and that can be confusing to some. And also, there might be food items listed that not everyone consumes, and so they require some kind of literacy. You need to know it requires some literacy, and that can also lead to recall bias and information about food preparation methods not always available, and also developed for a specific population and may not be used or may not be valid for different populations. So the FFQ might be developed for a specific population, but as that, to be able to use it for others, it's important to recognize that limitation. And then we have biomarkers. Biomarkers are more objective, and so they do not rely on memory or literacy. And because you're taking, for example, it could be from a urine sample, so you're not changing an individual's dietary behavior as much. And some of the strengths is that it accounts for bioavailability and supplements used because it's looking at biomarkers samples. And then it's very good for certain nutrients with high variability. But there can also be some issues with measurement errors and may not reflect the intake, fully reflect intake. So for example, some nutrients might not stay in the system as long as other micronutrients, and may not be available for all nutrients also. and it can be expensive. That's why and not everyone is able to do that. It can also be difficult to obtain. And then we also have another method is the anthropometric measurements for nutritional assessments. It's non-invasive, it's quick and easy, and it's cheap and requires a very simple implementation. However, some of the limitations, it does require technical skills and cannot identify protein or micronutrient deficiencies. And also, it's difficult to identify changes in the proportion of fat or in lean mass, and requires multiple measurements. Okay. So I started out by saying that nutrition is complex, but I didn't really go into the details of the complexities of nutrition. Well, one thing I hope that you're gaining or you gain from this first discussion is that when we're thinking of nutrition, there are many factors that need to come into play. We have the factors that are related to people behavior. It's difficult to change people's behavior. Environmental factors influence nutrition, social, biological factors, economic, and so many other concepts, or so many other concepts really affect nutrition. So nutrition is not as it's complex, but at the same time, it's important for us to study it because it's important for us to know what people are eating and how what and when people are eating, for example, how that eventually influences their health. And nutritional surveillance and balanced nutrition is important throughout the lifestyle. So I talked earlier about what people are eating at different stages of their lives affect their health. And we need data. So we don't want to just make policies and make decisions to recommend interventions without scientific evidence. So we need to be able to have some kind of scientific evidence in hand to be able to then move on to making recommendations. And nutrition research can provide economic and social benefits to individuals and communities and nations. Absolutely. So what might work for Lao might not necessarily work for a neighboring country, Vietnam, right? So it's important to know the social benefits, to know the culture, to know the people and their society and their behaviors when and looking at how all that interacts to influence what people are eating, and we can do that through nutrition research. Some different priorities for nutrition research include in developing countries include malnutrition, micronutrient deficiencies, chronic diseases, maternal and child health, food security/insecurities, access to healthy environments, and sustainable agriculture. So those are some concepts that are related to nutrition research that are priorities in developing countries. And this is not just in Asia, it's in developing countries everywhere. And multiple limitations can affect nutrition research in developing countries. And some of the things that can influence nutrition research in developing countries include economic, structural, education, and communication factors. So that's there, but one thing I always say is to just start where you are, to start where we are, and to see if we, what we can do with where we are instead of waiting until we have something to consider performing the research. And nutritional epidemiology allows us to look at how diet and nutrition, the interaction between diet and nutrition, and how they influence the population health over the life course. And nutritional assessment is very important as to nutritional epidemiology. Even though it's not a perfect tool, it is a tool that allows us to be able to assess what people are eating and then use that for research. I think that's it. Thank you for your time.
สรุปแล้วเนาะว่ามื้อนี้นี่เฮามาเรียนคอนเซ็ปต์โดยรวมของการค้นคว้าทางด้านโภชนาการเนาะว่าเป็นหยังมันมีความสำคัญย้อนว่าเฮาจะฮู้ว่าเขาจะกินแนวใดกินนี่อยู่ไสมันเป็นคือแนวใดสภาพมันเป็นคือแนวใดเนาะเพื่อนำเอาข้อมูลนั้นมาวางแผนจัดตั้งปฏิบัติปรับปรุงให้มันดีขึ้นเนาะดังนั้นมันมีความสำคัญที่ว่าเฮาจะต้องเฮ็ดการค้นคว้าบ่แม่นสิเดาเอาว่าโอ้กินหลายมันต้องตุยกินน้อยมันต้องตุยเนาะแล้วแต่ละประเทศสถานการณ์ก็แตกต่างกันบ่แม่นว่าการค้นคว้าอยู่เวียดนามสิเอามาใช้อยู่ลาวได้หลังเทื่อมันจะแตกต่างกันเนาะดังนั้นอันน่ะคือเพิ่นเว้าว่า nutrition epidemiology นะมันก็กว้างเนาะมันก็กว้างนะซึ่งว่าหลักๆแล้วมันจะค้นคว้าว่าเฮากินแนวใดแล้วผลออกมามันเป็นคือแนวใดสมมุติว่าเฮากินปลาตัวนึงเรื่อยๆผลออกมามันเป็นคือแนวใดเนาะนอกจากนั้นมันก็ศึกษาปัจจัยต่างๆที่เกี่ยวข้องซึ่งว่ามีหลายปัจจัยที่กระทบใส่กับโภชนาการซึ่งว่าปัจจัยเศรษฐกิจสังคมการเคลื่อนไหวของร่างกายแล้วก็บรรดาculture อย่างต่างๆวัฒนธรรมอย่างต่างๆเนาะนี่มันปัจจัยแล้วมีการประเมินการค้นคว้าทางด้านโภชนาการมันก็มีหลายรูปแบบเนาะหนึ่งอาจจะเป็น24 hour report เป็นการเอิ้นคืน24ชั่วโมงย้อนหลังข้ามคืนว่าพวกท่านกินยังได้ใน24ชั่วโมงผ่านมาเนาะแล้วตัวที่2นี่เขาจะให้บันทึกด้วยการบันทึกการกินอาหารว่าได้กินคือแล้วมีการบันทึกไปเนาะแล้ววิธีที่3เป็นการความถี่ในการกินอาหารจะถามว่าจะกินนั้นเรื่อยปานใดยังต่างๆก็มีคำถามออกมาเนาะแล้วตัวที่4ว่าทางด้านการชีวเคมีเนาะตัวอย่างว่าเฮาอยากรู้ว่าผู้นั้นท่านขาดแคลนวิตามิน A บ่เฮาก็ได้เหตุการณ์ประเมินทางด้านชีวเคมีและสุดท้ายมันเว้าถึงการวัดแทกร่างกายเนาะโดยเฉพาะเป็นเด็กน้อยอายุต่ำก่อน5ปีเฮาชั่งน้ำหนักแทกลงซึ่งเพื่ออยากรู้ว่าค่าสารอาหารเตี้ยสำเหือหรือว่ากระทันหันอย่างต่างๆหรือว่าผู้ใหญ่นี่แทกฮอบแอวฮอบกระโปงอย่างต่างๆเนาะอันนี้มันสร้างรวมทั้งหมดซึ่งว่ามันมีความสำคัญการค้นคว้าทางด้านโภชนาการคือเราเว้าย่อกันแหละเนาะว่าย้อนการค้นคว้าทางด้านโภชนาการแล้วจึงมีเรียกเฮ็ดที่แท้ก็บ่แม่นเนาะมันมีความสำคัญที่สุดเนาะมาฮอดนี้พวกท่านมีคำถามยังบ่หรือว่า feedback comment not just only question you can share the experience yeah lady first yeah
Thank you for your question about the questionnaire because I used to participate in the English seminar and then talking about the USAID research plan. So they very good question very useful for about 100. And they teach you to replace the 24 hours recording. And I would like to ask your opinion if they are strained or the good and the quiet and consideration more.
Yeah, I am please always can manage. I think that would be a bit more culturally relevant compared to something that's a bit more general, like the 24-hour recall. So, for example, I know for the 24-hour recall, even within the same country, that's using it, sometimes questions that come as relevance. The patterns of responses that we see on those are very different by demographics. So, but I think the one what you're referring to will be a bit more culturally appropriate compared to the 24 hours. So I would probably say that might be a better tool to use.
Excuse me, Governor Project, 1 minute for me to look back to slide 14.
14.
Which is very interesting to me, and I think that's very useful for others as well. If we talk a little bit about that during the whole session of these 2 weeks at any time. This is another question, but I have observation that these are some challenges rather than influences stuff. Yeah. So I have a few points that we might need to exchange a little bit more about in our context and in your context as well. What exactly influenced an nutritional study? For example, in general, as I observed, any study would be influenced by the existing policy and available funding. So what exactly in your country, you may share something about that influence the competition of research, competition of finding knowledge, finding some drugs are in the ocean, something like that. The first point, and the second part is the use of evidence. A lot of times that we try to produce evidence for policymakers. For me, I'm not so sure how, maybe Jared might ask something about the evidence for policymakers. I'm not so sure that how much they want. But in reality, how much people use it in the community. So this is the most challenging issue. Because so far, so many years that we have been conducting programs in nutrition, but when we talk about nutrition in grassroots level with people, they still mention the same thing. They never mention about a group of food or any specific type of eating, something like that. So I'm not so sure how we balance the evidence that we produce and the use of evidence on grassroots level. And the third point is, how do you see the private sector's contribution to nutrition improvement? Because I think private sectors influence a lot in decision making of people consume food, even ourselves. I think. Yes, even public health officer like us, we listen, we look into the advertisement. I'm not so sure how we include the private sectors to nutritional research. And fourthly, the last point, right? I observed that we so much focused in terms of nutritional epidemiology. We focus so much on numbers and relationship, and as such, it's good, but I think we might need to step a bit more further and deeper into the qualitative process. And to interpret evidence, I think numbers are not enough. That's from my perspective, and maybe we may need to discuss a little bit during this session. If you could add this, thank you.
Sure. Thanks, you were paying attention. That's very good. It's a fact. You're right. Maybe we should say challenges and not influences. To do research, you need money, right? And we also, there's sometimes all kinds of blocks, even if you have the money to even get the research started for different reasons. And so that's a reality, and that is not just here; it's everywhere. Even in the U.S., their funding is an issue as well. So that's definitely that's a reality that all researchers have to face, regardless of where we are. But I do think, though, that one of the things that I sometimes notice is if we want to perform some research and we don't have all the resources that we think we would need to do the research the way we would need it. If the will is there and everything else, the support is there, we can always start with where we are. To just, I think we talked about it, using something such as a pilot study or something, feasibility study, to then maybe eventually try to get more funding. So start smaller, start where we are, if it's possible, instead of not feeling like that block right away, that's not possible.
what else did you say? So in terms qualitative research, I agree. Maybe it's not just quantitative. I don't have a lot of experience and working with in that area. Maybe others do and can say more about it. But I absolutely agree that will give us more information than what we currently have, and that might be a good direction to go to head into. I know you had 4 points.
Private.
Private sector, yes. I was laughing when you said that because I'm part of this project that was funded by a certain private organization, and we did the analysis, and it has been so hard to get the fancy statistics analysis, so we can't say the analysis were not done correctly, but no one wants to publish it because, of the idea that this, you're doing research that's funded by this organization to say that what they do is good, right? So there's a bit of we talk a lot about rigor now, and so a lot of journals are a bit hesitant to publish that. But then also at the same time, the private sector, and I'm thinking more private sector or the industry, for example, that's funding something. I'll give you an example, and I think it was potatoes. It was potatoes. Maybe you know the story. I'm told that I often, when I tell stories, I kind of mix them up. So I'll let Roger correct me if this is wrong. But I think there was a study that was done with potatoes that. Do you remember the details? So, but it was basically so there was a study that it was funded by Potato Association, or I forget exactly what the name is, but it was showing. Oh yes, I know. It was saying that some people were saying that if you eat potatoes, it's too much. It's not good for you or something, and in a nutshell. And so the funders were not very happy with that, with those results. They did not want something like that published. And so that's also but then there's we're all scientists. It's also that sometimes it's not that simple. You can't just, people don't eat potatoes by themselves. So you can't just say only French fries, right? There's so many different ways of eating potatoes. And so that actually, that's an example where people might have done research, but maybe they didn't look at the whole picture. And at the same time, whether or not, whatever results they got, whether or not that became more publicly known by being submitted, it also was restricted because the people influencing and funding that did not want that out there. Another example is, you hear a lot now. I saw something where someone wrote this long post on LinkedIn, or maybe it was something they found somewhere else about how bad rice is, and rice has eating rice, carbs, and this and that, and then, but the thing though is that and so that was going on, post one thing on social media, the next person posts it, and then it just goes everywhere. But then the fact though is that someone pointed out, it's actually someone pointed out to remind us that that's actually, people don't usually eat rice by itself, right? When you eat rice, especially when you eat rice, you usually eat it with vegetables and stews and other things that, yes, it might have high carbs and so on, but then when you mix it with vegetables and other foods, that you actually balance it out a bit more. But that's also somebody influencing how we're eating, right? So all these, so definitely the public opinion, private sector, and so on, definitely influence how we talk about what research we do in nutrition. And I think there was one more thing.
That's already Purdue and very informative. I'll go for nutrition for sure. Yes, project.
So I want to make just one point quickly here. I know we right then. So I think you were mentioning something about qualitative research instead of quantitative.
Not instead of, but
That's a supplement, yeah, as a supplement. I remember. Yeah, I totally agree. But I think for me, and I don't pretend to know the nutrition field like 100%. But I think for me, one of the key question is, are we even doing what we can with the data we have? Because in nutrition, the nutrition field is really full of some statistical issues and, data quality issues. I mean, that have not been really, I don't think have been properly addressed, or people are still wrestling with issues.
and also some gaps in the tool as well.
I'm sorry?
Some gaps in the tool. So because the tools cannot exactly accurate.
You got it, yeah. And so what to do with those things? So the statistical, numerical data we have right now, I don't think it's clear that we've been able to do it best, right? And so I just wanted to add that.
Just to add, you asked so many questions and so I only them each halfway through, so probably that's a big step. But I mean, you raised the biggest question, right? Of how you work with government and what do policymakers really want is how to do that in the private sector. Like there are a lot of the area of food has so much power and money and economic forces that our work is sometimes fighting against the river, right? And I think there was a previous question earlier when we were talking about biofortification and golden rice and dietary diversity. But all of these things, I think there's never one right answer, right? You need a multiple strategies. So if you can, and you, as this group is working in education and government, you have that opportunity to have some influence, right? To have that continuous advocacy to the government or trying to make an argument about why these things are important to national health. You will always be against all these private sector influences. And so on. And there's some things that you can address with regulation, other things that you can address with when there are dietary trends, they happen very fast and they happen very strong. Right? Like somebody suddenly talking about Atkins diet or whatever. So it's something new coming, like so.
It used to be a better even as well.
Yes. Let's not get started on but so you need a multiple strategy. So I think it's going to be a continuous struggle. And we're not trying to make the perfect diet. Maybe that's something difficult. But if you can move a population towards having less salt or less fat or something, maybe it's not perfect, but the population that will make a huge difference in that's the thing.
Yeah, to be great, right?
Yeah.
And it's very home to that. So we bring around 16.
What I'm hearing say is it's important for me to learn appropriate techniques because I will be teaching other people. I have to know what's good, what's accurate, what's appropriate, so I can teach the young generation students. That's very much an important role, and that's really one of the key requirements here. Anyone else?
Không thấy
So you got 2 more minutes. Anyone else? Why?
có mẹ luôn vào luôn.
Yeah, for me, usually at my field, it's not about the nutrition, but we conduct another survey
So this,
about the strategy. Okay? Yeah. So if they can, I mean that if we conduct another survey about them or nutrition, I don't know. I have to learn more about the nutrition state and apply to them. And we do some research about it. Also, I want to learn about the food method.
the method? Okay.
And use the result to show the maker or show the people.
Right. And so you also want to learn appropriate statistical techniques and better communicate statistical findings, right? That's important. So once you've done such a hard work collecting the data, doing the analysis, now you need to communicate the policy to policymakers, to others, right? So they can understand the importance of your study, the importance of the findings, right? Okay? All right. Good. Yeah, that's great. All right. 1 or 2 more minutes. One more person. Anyone else?
ว่าภาษาหลักก็ได้สิแปลให้ไปอุ้ยยักแปลอยู่นี่นะยัก practice ภาษาอังกฤษยักแปล
Anyone else?
I say even Lao language you can speak in Lao I will translate for you เป็นยังจึงแบบนี้ยังจึงจะเขียนยังจักมายังเป็นยังจึงมาอาจารย์บังคับให้มาสันว่าหัวหน้าบังคับให้มาก็เลยมา
เวลาบังคับตัว
อยากได้คงเพิ่ม
In that she wants to know more about nutrition and want to know how to analyze what kind of product
The same thing that we want to be able to choose the appropriate, statistical analysis.
จะเสริมมาว่าเราจะบอกได้เกิดจากเรื่องมันเป็น construction นะ statistic หมอตรงนั้น
So as you can see, pretty much we don't have a single. We want to be able to, we want to be able to formulate our hypotheses. Right? Have a question of interest. We want to answer. We want to know how we go about collecting data. So that based on these data, we're going to apply appropriate statistical analysis, and then communicate those findings to policymakers and the rest of our population of interest, whoever needs to know the backgrounds. So to do that, I want to argue that it's important to know some of the basic techniques of statistical analysis. So I don't pretend that I'm going to dwell into highly technical stuff, but I really want to argue that if you understand these basic statistical techniques, right, then you can really start to think about your problem in a more critical way. Make sure that you avoid mistakes that are costly in terms of time, money, and in some cases, that cost you to have a paper or a finding rejected later on because of trouble. Okay? So that's really what I think to do here. And so by the end of the day, by the end of the topic 6.6, you should be able to really define what statistical inference is. So I'm going to really focus on statistical inference. And I'm assuming here, I'm assuming here that you collected the data. Okay? We'll talk a little bit about different ways you can collect the data, but I'm going to assume here that you are able to measure what you are interested in. I understand in some cases it's difficult.
we saw that we get nutrition in some cases to measure nutrient intake. So I'm going to assume that you're going to collect this. So I'm going to describe a little bit what the simple scheme based on this kind of relationship between sample size and powers. That's probably the second problem. So perform the step in the max testing in understanding competence intervals, different types of errors and power, including sensitivities. And then use open-ended. I say open-ended, but in fact, we can also use data to determine the sample size and power calculation and classification. These are really important steps for planning your study. All right, so sampling and inference. Most of the problems you'll be working with, or you are interested in, most of the questions you are really interested in answering can be framed with the following. You have a population of interest, Laos, kids, children in the house. And somehow you want to say something about it. Right? You want to argue in front of policymakers that you need to have you need to have some dietary intervention. Right? And so you need to convince them that there is a problem. And you need to convince them that your potential, your intervention, right, after you perform it, actually result in a difference in the intervention was used. And so the way we usually start is, again, we have a population interest, and then we're going to select a bunch of samples. Right? And so this type of this way of doing is really referred to as sampling. So we have a population of interest, we select a small group in the population. Then we measure some characteristics of interest. And so, because in most cases, right, unless you have unlimited enough money where you can select everybody, really in practical problems, you can only select just a small number. And then the goal really would be to say something about the whole population of business. And so, once we obtain the sample from that population, we can estimate the quantity of interest. Interest, what we will call our estimate the population characteristic. So that can be the mean variance using the sample. And so then we're going to use statistical inference to draw a conclusion to say something about the bigger population based on the small sample. Start out with the big population. But I want to say something as a characteristic. Assumption of fruits, data. I want to say something about that. So I'm going to select a small sample from their population. Record the data, consumption of fruits. And then based on that, I'm going to use a quantity to say something about the population. Quantity that I really don't know. So that's essentially what's this depicted here in the process. So I have a sample there, and the black line is showing that I have a sample. And so I started out with the population on the left-hand side of the bigger circle, and I have a small circle there that represents the sample that population. Now, multiple questions are. I'm confronted with multiple questions here. How do I select a small sample? How do I select a small sample? Because in some cases, the way I select it, right, can have really an impact on whether or not I can say something about the bigger population, big persons. Right? And so statistical inference is the process of drawing, some conclusion about the population using the information from data. First one is sample of the population. We make observation of variable calculated measures, their distribution in a simple, an estimated population parameters versus estimate quantity, or at least whatever information we collect from the sample, we're going to use that as an estimate of the population. And then we're going to quantify, right? Because we're only using a small sample, small group of the whole population, right? We're going to say something about what's the chance that we are wrong? How often or how much wrong are we? So classification. And usually the way we like to frame this, we have the population here, a simple frame, simple process, we have in green, which is small sample there, and then the inference now will be the line, the red line, or the small sample. Right? So now, and then really, as we move from the sample to the population, really what we have in mind though, is that we really have an hypothesis of the population, our hypothesis, or what we think the parameter, or what we think the statistical population we're interested in is, right? We have something like an hypothesis that tells us where we specify what we think the population parameter is, using the Greek letter here, mu, to represent the characteristic of the population existing. And so under the null, that's what I'm going to call the null hypothesis. I'm going to say what I think, or what the current literature suggests the value of mu is. Right? And under the alternative, I'm going to suggest. And again, so I will use the population whenever you see mu here represents population, right? Greek letters will represent population quantities, right? And then alpha numeric letter will represent X, Y, so on, simple. Right? So that's important, right? As we move on, I want you to remember the Greek letters, population quantities, and others will be simple. Something. Right. All right. And then of course, sigma here is the standard deviation. And so now, again, remember the goal, the game I'm playing here is that I want to say something about the population. Population is too big, I don't have money to select everybody. I select a small sample of the population. And then based on what I learned about the small sample of the population, I'm going to use that to say something about what I think the parameter, the quantity of interest in population is. That's it. Now, the rule says that before I can do that, before I can extrapolate or before I can draw the line from the sample quantity to the population quantity, some conditions need to be satisfied. In other words, the sample from which I will base my inference on. I will state my inference on the bigger population, the actually good representative sample from the population. You need to reflect the bigger population. Second, very big population. And then really simple statistics, right? Statistics based on a simple I use to estimate the population, the entire population. And so I can have the means, standard deviation, median, interquartile ranges. These are all the statistics. And I think later on today, in the afternoon, we see a little bit some of the descriptive statistics I can collect once I have the data. I can collect simple mean, that's average values, standard deviation, and the possible next thing. Now, so whenever I select the samples, it turns out that they're all what's what I'm going to call what we're going to refer to as probability sample. Remember, and I'm going to describe a little bit how I go about sampling this. How I go about sampling, obtaining my sample. But really, the basic idea is I'm going to use the idea of trace with this sample to really obtain my sample. And so with that, I will also associate probabilities. Probabilities, that's the probability of selecting each individual population. So I'm going to select the probabilities. And so highly desirable and I'll be allowed generalization. In other words, what I'm saying here is that if I go to the population and select a sample, I select a sample sort of a chance, right? Allowing chance alone to drive the way I select the sample. Then the sample that I got. results that are fine, the results that I get based on the sample can be extended to generalized. So it will be more challenging to implement if you don't have a well-defined and easy to reach population. And there are cases clearly where this approach where I go in and give everybody, every member of the population the same chances to be beat, right? There are cases where that might just fall apart, right? Can you imagine a case where that might fall apart? I want to get a sample. I have a group of individuals, right? And I just come in and say, well, everybody has the same chance to choose. So I come in blindly and I start choosing individuals. Can you imagine a case where I might end up with the same progress? You think about the case where that might happen. Okay, all right. So I have a population. Okay. I have a population. And then, and I come in and say everybody has the same chance of being chosen, so I'm just gonna choose people randomly without any consideration.
I don't think that's random. That's convenience. Without any consideration.
Well, I mean, convenience would be consideration, right? Because convenience will sort of imply. Convenience is sort of applying consideration, right? Convenience. Because when you say convenience, it's sort of so I'm just saying everybody has the same chance to be chosen, right? Randomly. So as soon as I have a random number of each individual, I just select them randomly. I put in a random number and select it. So that's a random sample. So I'm just asking you, can you think about a case where that might be the math? I go to a school, please. I go to a school. All the kids, I give all the kids, every kid a number. I get 5,000. And then I put them in a hat and I start randomly selecting. And I get a sample size 50. I'm asking, what might be a problem with that approach? Their way of thinking. Am I running into solutions? Can you think about it? Is what? Yeah, they're all school kids. They're all school kids. Girls, boys. They're all school kids. Girls, boys. What might be a problem? Well, chances are I might end up with girls only, right? Potential. That's true, right? I might end up with girls only, right? I might end up with girls only. I might end up with boys only. I might end up with tall boys only, even, right? And so on and so forth. You see the problem with that? Or I might end up with boys who just a single ethnic group. And then in that case, when I have an intervention, I don't know what's happening. Is the effect compounded by the fact that they're coming from the same ethnic group or not? I don't know. Right? That's a problem. Yes.
The question might be, how well can a sampling be done in a sufficient distribution way? The distribution of samples or the representation of samples. For example, in your case, in the case of school kids, if you got 50 students, 50 kids from 5,000 kids, relatively very too small. I mean, but in terms of representativeness, how our 50 students well representing the 5,000? So that's the question, right?
Well, it's not even so much a question, that question, right? Yeah, certainly, yeah. It's how those 50 kids are representing the population of 5,000, yes. And so my worry here is that the probability of random sampling is essential, right? Where I don't take care of any, I'm going to talk about it later on, potential subgroups in the population. So if I have a disproportionate number of subgroups here, where one subgroup, let's say I have more female than boys, and I randomly sample, I might just say boys, just but it's not quite representative. That's the point I'm making. Does it make sense now? And so, so that's no problem with sampling that way. But of course, I'll talk a little bit about ways to correct that. And then there is also the non-probability range, where the probability of selecting of the population is less than anything less. And that's really good for the specialized. And so, probability sampling design that I'm going to touch a little bit on, the following. I'm going to touch a little bit on the following simple random sampling. I think that's one I was just talking about. It's a systematic sampling, stratified random sampling. That's one way of addressing some of the limitations of simple random sampling and classroom. Okay? What's the simple random sampling is where, again, that's say when you have 5 kids, you throw the numbers, the name in hat, and this side. Ignoring the fact that, oh, wait a minute, I have girls, I have more girls, I have 95% girls, and compared to 5%. So that's one problem, one potential problem. I might have. And then I have a systematic sampling where, I have a list of individual population, and then the researcher chooses every case individually. And the first member of the sample class is going to be randomly picked. And after once I have that, then I start. My starting point is random. Again, I was mentioning earlier, clearly they have subgroup in the population. Because of course, you want again, your goal here is really to obtain a sample that's representative of the population. So if there are girls or if there are boys in your population, a representative sample would be really one that also has boys. And so one way we can do that is really by stratifying random sampling. So what we have, we perform sample random sampling in each number of samples. And then we have cluster sampling, right? So in some cases, right, the individual or the group you're interested in really come in some predetermined sort of organization. In this case, they have to come from the same school, geographic location, and so on. Right? And so what we can do here is to really, randomly select the clusters. We can select the clusters, randomly select the clusters, and and select everyone in the cluster. Okay. And I want to mention that each one of these really sampling approach comes from mutation and some data analysis adjustment when you perform when you want to analyze the data that comes from each one of these sampling approaches. Right? And then non-probability sampling there. So there's a convenience sampling, but where we're going to use subjects that are available to researchers, right? Because they happen, most researchers, they happen related to researchers, someone they happen to be easily accessed. And then there's the other, sampling approach, snowballing or sampling, where participants will go on the basis of their research. And so in cases like that, you have sampling, you have cases, you have studies where it makes sense to apply this because it's it provides the researcher with chances of recruiting individuals and stuff. Right? But I think the key here, what I want to tell you here though, is that to really understand the difference in these samplings and also understand, even though we're not going to go into the details here, that each one of them come with specific statistical issues that you need to consider when you do the analysis of your data. So now I'll talk to you about ways we can select potential representative sample. Where I can select a sample from the population. Right? So now we're going to talk about the process for inference. Again, my goal is that I have a target population of interest because I cannot include all the members of the population in the study. I'm going to select a small group, subset from this population. And then based on the information I'm learning from that subset of the population, I'm going to be able to see some population problem. I'll start with the prevalence of some disease, so malnutrition in a specific population. I'm going to select sample from that population, estimate the prevalence of the disease in that sample, and then use that to say something about what I mean. The prevalence of the disease in the population. Right. Okay. So, and so the step one, again, we're going to specify, right? The following step are really the steps we're going to use to do statistical inference. So we're going to specify our population and, sample from the population. Two, we're going to calculate the sampling distribution. So in most cases, it's mean. So some statistics based on when I'm taking the sample. And then I'm going to make inference about, I'm going to conduct a hypothesis test, come to the sample. I'm going to say, I'm going to test the hypothesis, scientific hypothesis, where I argue that, where I claim that on the null hypothesis, right, I claim that mu is actually equal to the population parameter is equal to specific value. And the alternative say that no, the population parameter is actually different from the given or specific. And then I'm going to make inference about the population based on finding my hypothesis. Right? Okay. But it turns out that, really, at the end of the day, when I conduct a study, I actually have only one sample, right? That's what I have. But you can imagine that someone else who comes in does the same study later on has also different sample. I just happen to have the sample that I have. Just a few changes. But in actuality, right? But really, what's true is that one can have different samples. You can end up with different samples. Right? And you can imagine that each one of these samples actually gives you different sample quantities, right? Okay. Because one sample, right, I have Peter here, and then maybe Peter is not in sample 2, so then each value here might be actually different from what I have in sample 2. All right. So, right? And so the difference between the sampling, between the characteristics obtained for each one sample is really what we refer to as sampling variability. So that's how the summary statistics, or the conclusion, or this, the information, or if you want, the summaries of the characteristic obtained in the sample sort of change as you change samples. That's sampling variable, right? And so now X bar, right? X bar, we're all going to use X bar really to refer to as the estimate of the characteristic of the interested. And so this can be what? Consumption of foods per week. It can be the amount of rice eaten, right? This can be nutrient intake, right? That might be characteristic of interest. And so X bar here really representing characteristic of interest, characteristic I'm interested in. Right? And then X is going to represent the simple variance or simple standard deviation of their characteristics. And then statistical theory tells us that these values here are used to estimate the population sigma. So estimate here means that these are guess values, right? These are guess values for the population mu and standard deviation sigma. All right, and so once I have these quantities here, I will now use this here to say something about what I think is what's the interest from that hypothesis test. All right, so now I'm going to quantify this uncertainty, right? The uncertainty which we do in precision estimate. When we don't know what the true value is, remember, we really don't know what the prevalence of some nutrient, or what's the amount of nutrient intake, right? Or what's the prevalence of the disease of malnutrition, for example, in the population. We really don't know what the true value is. We don't know what the true value is. Right? But what we do know is we probably know the prevalence of malnutrition in a small sample. We do know that because we assume that the data we collected is a good measure of malnutrition in the sample. And so once we have that, based on the sample there, we can compute what we call variance standard deviation, right? And so variance standard deviation tell us about the uncertainty, right? How certain we are about how certain we are about the quantity, the prevalence of malnutrition we estimate based on the sample. And so the larger the variance, or the larger the standard deviation, the more certain we are, and the smaller the standard deviation, the more certain. So all things being equal, we really want our standard deviation to be small because that tells us that we're certain about the quantity. Right? But it also turns out that statistical theory tells us that the sample size, right, as the sample size increases, the standard deviation tends to be small. And that makes sense, right? As the sample size increases, right, we're becoming more and more certain about the population. Because if we could somehow include everybody in the population in our sample, then we'll be certain about the value. We are looking, right? Okay. Because now we have everybody. So we have everybody in our sample. Really cannot do it, but if you can imagine we have everybody in the sample, then our sample estimate will be very close to the actual population quantity. So that makes sense. So as sample size increases, standard deviation varies, our uncertainty about the population quantity actually shrinks. All right. Now, so another tool we're going to use here, and I think some of what I told you about the idea of using the sample quantity to say something about the population quantity is actually rooted in one of the key theorems statistics called the central limit theory. Right? The central limit theory says, well, the central limit theory says that even if I have a characteristic of interest, right? I have a characteristic of interest, and I know that the characteristic of interest I'm interested in, and the characteristic of interest in the population has the mean mu, as an average value, mu, standard deviation is sigma. If I were to collect a bunch of samples, right? If I collect sample 1 of size n, I compute the mean and I compute the standard deviation for the sample. Right? Mean x bar. And I repeat the same process multiple times, right? I collect a bunch of samples. Each one of those samples has size n. And I look at the distribution of a x bar 1, that's the sample 1, that's the mean for sample 1, mean for sample 2, mean for sample 3. That distribution looks like that's a symmetric distribution where most of the values will take a cluster around mu, population mean, and the standard deviation much smaller than I expect to see. So that's what the students really do. Right? If you could go in the population, get multiple samples, right? The distribution, the sampling distribution, I was having approximately the normal distribution, bell-shaped curve. So it turns out that this has profound implication in statistics. It will be the underlying reason why we use Z-tests. This is simple. Right. And so, and then also the theory suggests that actually that distribution can get, the result that, the theoretical result we have can be accomplished, right, for fairly small samples relatives. This when n is right around, when n is greater than 25 or right around 30, the theory starts to really be, we get very much very high. Yes.
Start working with statistics. Start saying. Let's say student 5. We break down 65 is not that's why it's fine. I'm not too confident, okay? We can assume 30 or whatever number is good for statistical analysis.
Right. So let me understand. So you're saying here that in your application, in most cases, the sample size is very small, right? It's not 25, it's smaller than that. So now there is where one can go down, right? So the value of 25 that I put here, it turns out that in some cases you might need less than that. So if your data to begin with symmetric and normal, maybe you don't even need point. Some cases. But there also are tools that can allow you to sort of see if the data you have here is approximate. So, and then we can talk a little bit about that, ways we can see that, and then I can talk about specific examples. But so this is sort of the rule of thumb. Some cases it's a little bit different, other cases, but roughly that's what we. But that it doesn't mean that it's true for every case. That's what I want. Right. So that's essentially the theory. So what does it say? Well, let's look at, if you look at this plot here, the first panel is the characteristic here. So if I look at the characteristic across individuals, right? So I have a bunch of individuals for which I'm looking at the characteristics, right? Okay. I'm sorry. So I'm looking at here, so the first row is just the case where I have a sample size 1, essentially, right? See up there. And so now as I go to the second panel, the second row, I have the sample size 2. And then you can see you still have different shapes. But as I get to n is equal to 5, the sample size 5, look what's happening in the distribution. So start becoming so you remove one more, go up, come down, up, right? But as I get to n over 30, then I start to see that the distribution get a little more. Yes.
This picture, which one is the best of the sample sizes?
So here I'm suggesting, so here's not so much best. Here I'm suggesting, I'm giving you an intuition of what the theory behind saying is like, if you couldn't select, here what I'm saying is that as you increase your sample size, right? As you increase your sample size, then your certainty, your distribution is becoming a little more symmetric. That's really what I'm saying. As your sample size increases, the distribution is becoming more symmetric. And so if you want to do test hypotheses later on that we see, then you can use some of those, we can use the Z test and T test. That's really what I'm saying. Right? Yes,
Just because I just want to ask, if someone can explain like why Professor Roger is spending so much time to explain something. Why does it matter?
ก็ตอบได้เป็นยังไงผู้ไปซื้อแล้วจึงเว้าแท้เว้าว่าเรื่องอันแซมโพนี่เราอธิบายกลับไปกลับมันกลับไปกลับมาซุ่มใจเว้าอย่างนี้
พวกเป็นตัวสร้างที่สำคัญจริงๆเพราะว่าเป็นตัวสร้างที่สำคัญเกี่ยวกับเขาจะเป็นวิชา
She said because the sample size is very important for the research.
Can you say more or others can say more?
มีการเรียนเด
Answer could come up. The idea is interview everyone, but impossible. That's why taking the sample, listed sample is the key. Tell the story if you want.
The sample size is representative of data in the world sample size. Maybe our data is scale.
I'm also looking at it, right? Sample size, your sample size being important, yes. But then there is another key technical thing. I think I'll probably say that do a little bit. Why? I don't care about sample.
So, if a researcher is fair enough to random nicely, the mean of the sample will be very close to the mean of the population. Whether the mu or x bar, we don't know for sure about the mu, right? But we expect x bar to be close, not equal, to be close to the mu. Okay. So a lot of samples that you have shown the distribution of something, maybe age or body mass index or anything. The distribution, the more you random, the more you go close to the
Right. So the higher the sample, as n gets larger, as you get more samples, then your sample mean is very close to the population. Right? That's true. But then there's another concept. Have you all heard about the normal distribution? Normal distribution. You've seen how many? I mean, you heard about T distribution, right? T distribution, T test, T distribution. So it turns out that one of the reasons why when we do our test, C distribution, it's because of the C.
The T or the C. In reality, we rarely see the normal distribution in our sample, as we imagine as a
Right. And then why is that? Remember the idea. Remember, I want you to think about it. The way you think about it, you will not see why. Well, you will not see the normal distribution. Why? Because we're taking only one sample. If you took multiple samples, if you took 100 samples, each one of size 50 or 30, and then you plot it, then you see the normal distribution. But when we do experiments, we only get to see one sample. But now, because we have computers, and because we can make experiments using samples, that's how we know if you were to get multiple samples, each of size 30, and you do them multiple times, you have a better picture. And also because central limit theorem tells us that. What the central limit theorem is telling us. telling us that even though we have observed only one sample minute, but if it were good, by some magic, if you had a lot of money, and you could get multiple samples, then the expert you got is just a realization of normal distribution. One realization of the normal distribution. That's the here,
Can I give an example maybe from your photo, the picture of the board? So I was thinking of this, the second one with the two bump like that. That sometimes it's called binaural because it has two and two bumps, right?
Yeah.
So imagine you go to a district and you want to measure insecurity, right? So you might have a questionnaire, you give a score, and it's some kind of number. So you're not interested in everybody's food insecurity or one person's, you want to know average food insecurity, right? It's not like one number, if you want the average, that's what you're after. That X bar is the mean or the average. And then you want to do a lot of statistical inference and ask hypothesis tests and all of that about the average, right? And what you're saying is that in the food insecurity in your district might look like those two bumps, right? You might have some wealthy people, they're food secure, they're good. And then you might have some people who are not very wealthy and they're food insecure, right? So the distribution in the whole population, it might look very strange. And you don't know what it is, and it's very unusual. But you don't care, because what you want is the average. The distribution of average looks like those things on the bottom, right? If you take a sample, even from that funny population like this, the average has a very smooth bell-shaped curve. And that is what you're going to use for all the hypotheses. And that is the whole point of the central limit theory. In the population, something strange is happening. It can be skewed, it can be square, like a square, it can be 2 bumps, 3 bumps, whatever. But the